Hi ladies, this is Treva. Sorry about the lighting with this video. I'm recording from my tablet and I'm in my bedroom and the lighting isn't all that great in here. And I'm also sorry for the shakiness of it as well. But the reason why I am in the bedroom, I will let you know about in a moment, but just want to give you a recap of everything going on. I do apologize that it has been some time for me to make a video, but I've just been so tired and, work. I've been doing a little bit of overtime with work and everything, so I just haven't had the time to make a video, but I'm on bed rest now, so I can make a video. Several videos. Anyways, but I'll get to that in a moment. Firstly, on September 17th, that was my last appointment with my RE's office. Everything went well. Ultrasound was great. Baby looked good. The nurse at the time told me that I could stop taking the SCH and also the dexamethasone steroid. But she told me to continue taking the low-dose aspirin, what else? The progesterone oil and endometrium vaginal progesterone suppositories until October 17th, which will be my 12-week mark. So I had already set up an appointment with a new OB. He actually is in the perinatal center at our local hospital here, and he is a high-risk doctor. I'm so glad that they took me on as being a patient because I have been told by several that he is one of the best in the area. When I went to the appointment with him on September 23rd, he was very thorough. He did an ultrasound, the blood work, a urinalysis, pap smear, pelvic exam, breast exam. He was just very thorough with everything. Everything looked great at that time with the baby as well. Heartbeat was really strong. I think at that time was like 170. And the baby was actually measuring a few days ahead of time. So everything went well with that. He set me up to come back every 2 weeks, being that he does consider me as being high risk because of my advanced age, and also because previously it's funny, 20 years ago, when I had my son, I did have an incompetent cervix. So he wants to really keep an eye on that and make sure that that doesn't happen with this pregnancy. He advised me to stay on the endometrium suppositories up until I'm 16 weeks. I can still stop the aspirin and the progesterone oil at 12 weeks. After 16 weeks, though, I will be taking a progesterone injection, and it is called Makena, Makena. It's actually the first and only FDA-approved medication to help with the risk of preterm labor and miscarriage. He wants to keep me on that, being that I did have the incompetent cervix. He also is going to keep an eye on my cervix to make sure that it does not shorten or start dilating early. If so, at that time he will do a cerclage. And that's basically putting stitches in the cervix to make sure that it does not dilate. So everything went okay with that appointment, and I wasn't scheduled to go back until October 7th. But there has been a change of events. Saturday I noticed that I had a little bit of cramping on my lower left abdomen, and I looked it up, and everything that I had read online was just stating that it could be my uterus expanding and growing, and just basically what they call growing pains. I went to sleep the next day, it was still there. Um, Took a nap later on that Sunday, and woke up, it was still there. So I started to get a little bit concerned. So I told my husband that I wanted to go to the ER just to check things out, make sure everything was looking okay, and that it wasn't anything serious. After being in the waiting room for 4 hours, yes, 4 hours of in the waiting room, horrible. They had already done my blood work, urinalysis, and ultrasound, and checked my vitals 3 times prior to getting us back into a private room. Ultrasound was pretty good. Baby was moving around and everything, so my husband got to see the baby finally with it moving around, and the heartbeat was 185, which is very strong and perfect for at this time of gestation. So everything looked great with that. But once we got back into the private room and the ER doctor came in, she stated to us that the ultrasound showed that I have 3 fibroids, one small one inside of my uterus, and it actually happens to be on the lower left side, so that's really weird. It's probably the reason why I'm having cramping on that side. But also too, I have 2 that's on the outer layer of my uterus. She also said that I have a subchorionic hemorrhage, and that is a hematoma or a blood clot in between the forming placenta and the uterine wall. She said that it was very small, and I need to follow up with my OB to see what they wanted me to do, but she did put me on bed rest for today. I called my RE's office this morning, spoke with the nurse. She told me that my appointment is at 3 o'clock tomorrow, and I need to remain on bed rest until I'm seen by the doctor. Possibly the doctor is going to have me stay on bed rest until the hematoma has cleared up. So I don't know how long that would take. I don't know anything. And I really don't know much about the subchorionic hemorrhage. And I really don't know how the fibroid that's inside of my uterus will affect my pregnancy. But I will find out more information tomorrow when I go to my OB. Needless to say, I am a little worried about everything that's going on. It was a little stressful when you go in and they find things that you didn't think that was there, because usually with a subchorionic hemorrhage, you do have bleeding, and I have not had any type of bleeding at all. So, but it is good that we do know, and it can be watched at this time now. Some of my symptoms that I'm having at this time is, I have such bad acne on my chest and my shoulders, shoulder blades. I've never had acne before. Also with my face, it's just, sometimes it gets really red and itchy, like something is irritating it, like I have an allergic reaction to something. And then the next day, it will be dry and peeling, and that just keeps happening over and over again. I have tried to change my regimen of how I cleanse my face and tone it and different things of that nature, and I'm still trying to find the right regimen. What else is going on? My intralipid IV. When I switched to my new OB, I had mentioned to them that I was taking intralipids, and I was told that I would need them every 28 days. And my next one was supposed to be on the 2nd of October. He explained to me that they didn't do that there in their office. He didn't know where I would have to go to have the infusion done. So they contacted CNY Fertility, my RE's office, and the RE's office told them that being that I had already had 2 infusions, that I possibly didn't need the third, but if it would make me feel more comfortable to have the third, then I would have to have it done at CNY, which is an hour away from us, and it costs $40 copay just to go because it's a specialist, and also gas. So I decided not to. Everything's been looking great with the baby, so I decided not to do that. But I will jump back on here and update you and let you know everything that's going on after my appointment tomorrow. Because like I said, as for right now, I have very minimum information on everything that's going on. And I really need to get some answers to put my mind at a little bit more ease with things. So pray for us. Pray for the baby. I'm hoping for the best. I think everything's going to be okay, but I still have that little bit of nervousness, yeah. Thanks to all of my new subscribers. I have quite a few in the past few weeks. I really want to thank you so much. And also thank you to my old subscribers as well. You guys are great. Thanks for your inspiration, your encouragement. And if anyone ever has any questions for me, please feel free to let me know. I always am here to help as much as I possibly can. So, like I said, I'll get back on here tomorrow and update you with everything that's going on. I hope you ladies are having a wonderful day, and thank you so much for watching. Smooches. Bye-bye.